Cultural competency vignettes for use across the occupational therapy curriculum, an educational video. This video was created to raise the cultural awareness of occupational therapy students and other healthcare professionals, and to initiate a discussion about cultural competency. Changing demographics and an increase in multicultural environments highlight the need for culturally competent healthcare professionals. Cultural proficiency is not achieved only by learning the facts about other cultures, but also by suspending one's own cultural perspectives and biases. Occupational therapy requires a close collaboration between clients and therapists, thus making cultural sensitivity paramount for practitioners. But a recent survey found the vast majority of new occupational therapists felt unprepared when working with clients from different cultures. In this video presentation, you will observe a series of vignettes in which cultural competency issues are raised. After viewing each vignette, the class will have an opportunity to discuss and analyze how cultural differences affect outcomes, and what modifications could be made to improve future practice. In this vignette, we'll see a common classroom interaction.
Okay, take a break. Come back in 10 minutes.
Ooh, Sarita.
Yeah.
These were the exercise shorts I was telling you about. The ones that make me smell like a cab driver. It's super gross.
Oh yeah, there's a guy on my block who smells like that. You have to get rid of that. But I've seen a lot of people wearing these shorts.
I don't know, I tried those on once, but they look kind of weird on me. Like, they make me look hippie.
Oh, don't be retarded, Naomi. I'm sure they can't be that bad.
I don't know, maybe I'll just wear them when I'm running by myself so nobody will see me.
Hey, do any of you guys have the notes from lecture 3?
Yeah, I do.
Did anything happen that could make someone uncomfortable? Let's watch the scene again.
Yeah, I've seen a lot of people wearing these shorts.
I don't know, I tried those on before and they look really weird on me. Like, they make me look really hippie.
Oh, don't be retarded, Naomi. I'm sure they're not that bad.
Yeah, Sarita, I don't mean to sound obnoxious, but I really don't like when people use that word. It's kind of not cool.
Oh my, Naomi, I'm really so sorry. It totally just slipped right out of my mouth. But you're absolutely right.
It's okay, don't worry about it.
Questioning people's use of language can be difficult and awkward, but in today's multicultural society, we should be open to comments or discussion that are in the end molding us into more aware people.
Ooh, I like this.
Don't be retarded, Naomi. Those are way too expensive.
Yeah, but they have them in purple. I don't know, maybe I'll just splurge this time.
I don't mean to interrupt. I know you didn't mean anything. I'm not sure you meant that word the way you said it.
What word?
Retarded? Kind of offends me the way you say it like that.
Oh my God, Lauren, I'm so sorry. My brother's been throwing that word around the house all the time, and I guess I'm just picking up on his bad habits, but you're absolutely right. Thank you for telling me.
No problem.
How would you have handled it? In this vignette, we'll observe an initial interaction between an OT and a client.
All right, Miss Joel, I'm going to get the OT. When you finish your session, I'll come back and take you back to your room. Okay.
Hi, Miss Joel. I'm Evan. I'm going to be your occupational therapist.
Hi.
What could be the reason Miss Joel ignores the offer of a handshake? Let's look at one way to handle this.
Hello, Miss Joel. I'm Evan. I'm going to be your occupational therapist. Oh, I'm sorry. You don't shake hands.
No, actually, I'm religious. Men and women don't touch in social situations.
That's perfectly fine. But as part of our therapy session, I may have to assist you. How can we work better to do that?
For medical and therapeutic purposes, there's no issue for men and women to touch.
Okay, well, thank you for explaining that to me.
Thank you for asking.
Discuss your reaction to this exchange. In this vignette, we will see an OT conducting an exit interview with her client, Mr. Cooper.
Hi, Mr. Cooper. I understand you're going to be leaving us soon. I just have a few questions to ask you about how you're going to be managing once you get home.
What would you like to know?
All right, well, you've been taught how to use this walker appropriately. Adjust it back to these settings should anything get changed accidentally.
Yes.
Wonderful. Now I have just a few questions to ask you about how you're going to manage some basic skills around the house. Do you live alone?
No.
Oh, wonderful. Is your wife picking you up?
I'll be taking a cab.
Okay, that's just fine. Will your wife be available to help you if you're going to be needing it?
Look, I'm gonna be fine when I get home. I have everything set up. You can stop asking questions.
What happened here? Let's take another look at the scene. Here's one way to handle the situation.
So, I just have a few questions to ask you about managing basic skills around the house. Do you live alone?
No.
Oh, wonderful. Do you have a wife or a partner, a roommate, someone to help you manage making meals, getting dressed, walking the dog if you have one?
Yes, my partner will be picking me up, and he has all the pamphlets that we were given on how to prepare the home. Oh, and no dog.
Oh, great. Perfect. So I just have a few more specifics to go over with you, mostly regarding this walker, making sure you know how to use it, adjust it to the right hip setting.
What do you think? In this vignette, we'll see an interaction at an outpatient clinic.
You're going to use this hand and you're going to pick the beads out of the putty.
Oh my, oh,
Oh, let me help you, Rose.
I'm sorry. Sorry about that. So what were you saying about the race for mayor?
Well, just so, I mean, based on all of the things the other guy did, you'd have to be a total idiot not to vote for Susan Walker. She's a much better candidate. She's a great speaker. And I mean, seriously, who would you vote for? I mean, that other guy is a total moron. Look what he did to the city's budget. You know, I just think he's suckered so many people into liking him, and people are lemmings, just waiting in line to fall off a cliff.
Yeah, well, he's just a little bit too gay for my taste.
Yeah, hi. Can we talk about this at lunch, please?
Sure.
Never would even be even better.
Sorry.
done.
Great. Okay, so now we're finished with this, and you're going to move on to taking these, also with this hand.
Has anything been said that could make someone uncomfortable?